Are you suffering from pain in your feet? It might be because you have flat feet or fallen arches.
Did you know that there are 2 types of flat feet? We're going to tell you exactly what they are and what you can do to improve them. Join us as we go over an anatomy breakdown of the 2 types of arches.
Take you through 2 tests to help you to figure out what kind of arches you have.
And 3 of our favorite ways that are helpful for decreasing your pain and improving your arches.
Did you know that there are 2 types of flat feet? One is called flexible and one is called rigid. Flexible is the most common. It speaks to you have an arch, but when you're standing, your arch drops. Rigid is no matter what you do, your feet look flat. Let's talk about flexible for a moment. Flexible, you'll see a lot in children, especially before the ages of 7 and 10, because that's when their arches begin to form. So if you have children around that age, there's no need to really panic and overcorrect if you're seeing that their feet are caving in. They just are incapable of actually having arches just yet. Hang in there. If you're an adult and you're seeing that your arches are dropping when you stand, you can do things like exercise, scraping, and rolling to improve the connective tissues and the muscles in the arches themselves. If you have rigid flat feet, it's a little bit more difficult to maybe restore your arches completely. It is probably more an indication of something hereditary. It may actually be that time where you're like, I got this from my mom or I got this from my dad. That doesn't mean that you can't improve. It just means that your feet are going to look more flat than maybe another person's. You can still use scraping. You can still use exercises. You can still be better. Later, we're going to go over techniques on how you can restore your arches.
But for now, let's get into the anatomy. So we are going to talk about the 3 arches of the foot. Typically what we think of when we think about the arches of the foot, we think about this inside one, medial longitudinal arch, which goes right through here. Then we have this lateral longitudinal arch, and then also this transverse longitudinal arch. We'll talk a little bit about all 3 because all 3 are important, though this medial longitudinal arch is the one that gets a lot more airtime. So let's get down to the bones to visualize this a little bit better. So when we talk about this medial longitudinal arch, we're talking about all of these bones and these ligaments and muscles that are in this inside part of the foot. So as you can see here, all of these are all these little ligaments. Underneath here are all these bones. These provide the passive structures of the arch. And then you can see here, this is the lateral, and then here is that transverse. All 3 of these have to work together to support the foot. When I talk about passive structures, I talk about things that don't move by a contraction. So those are ligaments and those are bones. So the shape of our bones and also the ligaments that support bone to bone, these are passive structures. So they're not under our voluntary control. Now, if we look a little bit deeper, here we'll start to see some of the other layers of the arches of the foot. So here is this plantar fascia and also what's called your plantar aponeurosis. This is another passive structure. This plantar fascia is really important for the support of the medial longitudinal arch, the lateral, and also transverse. When we talk about the active structures of the arch, now we're starting to talk about what are called intrinsic foot muscles. So these are muscles that start and end within the foot. So you can see here, there are tons of layers of them. What we also get when we talk about the arch are what we call extrinsic muscles. So these are muscles that start from the outside of the foot. So actually the muscles in the back of the calf that are really deep, those actually attach in through this part of your foot. So you have some intrinsic foot muscles, and then also some extrinsic foot muscles. These provide the dynamic support for your arch. When we talk about the normal arches, normal and also a dropped arch, what we're mostly talking about is this medial longitudinal arch. We're still considering the lateral longitudinal arch as well as the transverse, but here we can visualize the medial a little bit better. So here, when you step down, remember the arch is supposed to provide a load-bearing support and also shock absorption. So you see here, this is where all of these passive and active structures, this like bottom part here, they're doing what they're supposed to. So you have all your body weight comes through. And then what ends up happening is that this whole area kind of works as a spring to make sure that you maintain this arch here. Now, When you see the dropped arch, that's not happening so much. So you end up seeing that all these structures then start to move to the side, and that's what's going to create excess stress to this bottom part of your foot. There are two types of dropped arches. There's rigid, meaning that no matter what, the structure of your foot is such that this is going to happen. So that means that the bones are like further down essentially than what they kind of ideally should be, or the ligaments also don't necessarily support that whole area. So you can't necessarily then fix that just by strengthening the muscles in the foot. If anything, that actually makes it a lot harder on these extrinsic muscles and also on the intrinsic muscles and things like your plantar fascia, because the bones just don't support what it is your foot is supposed to do. So then you end up having to overwork these extrinsic and intrinsic muscles. For a flexible dropped arch, you can actually do some things to improve that. When we're talking about a flexible dropped arch, what ends up happening is that this part of your foot ends up kind of flattening out. What you can actually do is by strengthening this musculature in the foot, you can improve the ability for all these muscles to support this inner part of the arch. This posterior tib tendon is what provides a lot of the dynamic support for the arch. Stay with me here. Okay, so when we're talking about this posterior tib, now here's the back of the calf. So this muscle starts up here, right? Then it's going to come down in through here, and you see all of this blue right here, this is where the posterior tib attaches. This is all of this inner part of the arch. This is what provides a lot of the dynamic stability through the arch, as well as this flexor hallucis longus, which is like the muscle that comes from up here down here, and that controls like what your big toe does, which can definitely contribute to some of this positioning of the arch, as well as within here are all of these small intrinsic foot muscles too. So by strengthening things like the posterior tib and then the anterior tib, which is in the front, that's what's going to help to kind of lift this part of the arch, as well as strengthening the intrinsic foot muscles. That's what will help to lift that. If the bones of your foot are shaped such that they're already kind of in a lower position, that would be like a rigid flat foot, you can do all the strengthening you want, but it's actually not going to create a change. What can we do about that?
There are two really easy ways to quickly find out if you have flexible or rigid flat feet. One is you would stand up on your toes. If when you stand up on your toes, you notice that your arches come back, that means you have flexible. If you're seated and not weight bearing at all and you see that your arches come back, that also means you have flexible.
Let's go over 3 ways to address the issues in your feet.
We're going to go over how to use a hypersphere mini, a hypervolt, and a sidekick for loosening up the connective tissue, decreasing your pain, and restoring your arches. Here's what you can do with a hypervolt to improve your flat feet. What I'm going to do is I'm going to focus in on the bottom of my foot here, so that way I can get to some of the flexor muscles that often lead to that tightness. I'm going to turn it up. You can play around with the settings between 1 to 5. I have it on 4 right now. I'm going to try my best not to laugh. Your pressure should be at about medium firmness, but you can go based on your own tolerance. You should be able to actually see your foot move a little bit, the arch itself kind of wiggle, because that's showing that you have some flexibility in there that you can restore. Spend about 30 seconds on the bottom of your foot, but also make sure you spend some time going through your calf. Oh, that hurts. Oh my God. Hold on. Spend some time going through your calf, and then also through the front of your shin in your anterior tibialis. Make sure you go back to the places that you know hurt the most. For me, obviously, it was in the back of this here. So when you get, oh man, that hurts. When you get into these areas that you know hurt, hang out there and it will begin to relax. I can now breathe again. Do this every single day, at least once a day. Using the sidekick tools is one of our favorite ways to teach people how to treat themselves. What you're gonna do is you're gonna apply enough pressure into the bottom of your foot so that way you take out some of that slack there, and then you're gonna begin to scrape back and forth. I'm a little ticklish, and you might be too. What you're gonna do is go back and forth. I would use a gel that comes with the tool to make this a little bit softer on your foot if you need, but if you can tolerate it on the skin, you can go directly. You could see the bottom of my foot actually the skin move back and forth, which means that I am moving that connective tissue, that fascia around. You spend about 30 seconds at least on the bottom of your foot alone, getting in between the toes and then getting into the arch. Remember, you have 3 arches. Get to the outside of the foot, not just the inside, and also get across the front here in the ball of your foot itself. Spend time in the front of your shin on your posterior tibialis, as well as on this side here for your anterior tibialis. You're gonna do it the same way, just enough pressure to take the slack out, and then going back and forth, cover the whole region. Do this every single day, at least once a day, and you will feel your pain change and you will begin to feel your arches come back. The angle is important that you're scraping yourself, but the sidekick tool has a double beveled edge. So all you need to do is add just a little bit of a tilt into the area that you're scraping. Don't just go straight in, tilt just a little bit and add about medium pressure. I like to use the mini sphere and not just a lacrosse ball. What you're gonna do is you're gonna turn it on, hold the button in till I get my lights. Then I'm gonna select for a level of vibration that feels most comfortable. We'll start at a level 2. I'm gonna place it on the ground, get my foot right underneath it from the start so that way it doesn't start bouncing around. You're going to apply a medium amount of force of your body down. If you go nuclear, it's gonna be too much. I'm going to slowly roll this ball through my arches. Remember, you have 3 arches. You have the one on the inside, the one that goes across the ball of your foot, and then on the outside. Get the whole thing. Spend some time on each of those points. You can see my foot's actually forming over top of the ball itself. The vibration itself is helpful because it increases circulation and blood flow and helps to further loosen the connective tissue around your arches by sending a signal to your brain and back to the area. So spend about a minute or so on each foot at least, but you can definitely spend longer if you feel like you're getting something from it. Do this every single day. No matter what type of flat feet you have, what you're going to want to do is you're going to dedicate some time every day, at least 10 minutes, where you're going to pursue improving your arches. Improving your foundation, that being your feet and your arches, will change everything about the way that you go about sport and activity or just walking around your environment. If you need a little extra help trying to figure out what to do and you want some more structure, feel free to reach out to us. We're happy to help you. We have an MDRX program just for this, the MDRX Arch Restoration Program. It's a 10-minute-a-day program. It's easy to do. You won't need anything special.
This week we taught you how to loosen up the connective tissue to regain your flexibility.
Make sure you join us next week for strengthening exercises and a primer to improve your arches.